Madam, good evening. This is for the assignment with environmental protection mechanism in India, and topic of my presentation is legal framework for regulating biomedical waste management under Environment Protection Act 1986. So, introducing the topic, this is regarding biomedical waste rules, which was notified in 2016 under EP Act, under the sections 3, 6, 8, and 25 of the Act, where central government is empowered to make rules for the safe environment and where proper disposal of the biomedical waste can take place. So, in supersession of this 1998 rules, which was notified with the judicial pronouncement in BL Vadhera case in 1996, and then there are other exceptions to these rules that municipal solid waste, electronic waste, radioactive waste, and hazardous chemicals, they are being covered under different rules notified under EP Act under the same sections. So, concerned people who are covered under this rules are hospitals, clinics, nursing homes, and research laboratories, diagnostic laboratories, and other kind of establishment. Even Ayush hospitals are covered. And most vulnerable section which comes under this act are medical care professionals, maybe doctors, nursing staff, laboratory staffs, and even scavengers who are like rummaging the municipal waste at landfill sites are also likely to get some infections if the wastes are not handled properly. So, under these rules, there are some authorities and some stakeholders where the occupier, who is the owner or operator of this healthcare establishments, they are having a responsibility cast upon them to make provisions for safe handling. So there are color coding systems in the rules where yellow, red, blue, and white category of waste are being collected separately under separate containers or some bags, and which are transported to common waste disposal site where the wastes are being treated firstly and then disposed either for recycling or for burial and segregations and all. So we have under constitutional provisions which the framers never discussed environment at the time of founding the constitution, but later on in 1976 under 42nd amendment the sections were added, and those were section 48A, 51AG, and 17 entry number 17 in concurrent list, which talked about wildlife and forest. So the whole movement regarding environmentalism started with the Stockholm Conference in 1972, where several rules were propounded as precautionary principles, polluter pay principles, then intergenerational equity and intragenerational equity, and then only under precautionary principles it was propounded that every environmental project which would be having environment impact assessment and then some regular and periodic audit, also the environmental audit as well as social audit would take place. Also, this is covered under right to health, where the society, each member of society is having that health right, which is discussed under Article 25 of Universal Declaration of Human Rights also, and Article 26 and 12 of International Covenant for Economic, Social and Cultural Right, where general comments also number 14 deals with